If you're on Medicare or about to be, there's some things that you might want to be aware of that deal with Medicare fraud. And there are some crazy things that go on out there. So we decided to bring in an expert, Danielle Guillory, Community Outreach Specialist with Senior Medicare Patrol. How are you?
Good morning. I'm fine, thank you.
Good to see you again. It's been a while.
It has. Pre-COVID.
It was pre-COVID last time we got to talk to you.
Yeah.
Tell us, if you would, tell us a little bit about yourself.
I am the Community Outreach Specialist for Senior Medicare Patrol. I've been doing this on the Gulf Coast now for approximately 4.5 years. Senior Medicare Patrol is in all 50 states, so we actually have 3 community outreach specialists just for Mississippi. I cover the 15 lower counties. And what we do is go out and speak to seniors about how to protect their Medicare information from fraud, waste, and abuse. And actually, this is the 25th anniversary of Senior Medicare Patrol. We are a government grant program funded and administered through the Administration for Community Living, which is directly under CMS.
Now, a lot of people might not think about Medicare fraud. What kind of, what type of fraud do you see the most often with this? I mean, because be honest, I'm about to get on Medicare myself. Medicare, was it Program A?
Right.
Program A, which, I know for seniors it is a free thing. Yes, I'm a senior, so.
Aren't we all?
But it is a free thing. Of course, B, when you start looking at the other supplements or whatever, it costs you a little bit, but A is something different.
It's the hospitalization portion, and that's what your Social Security has and Medicare that they've been taking out of your check. That's what that covers.
Okay, so what type of fraud do you see most often?
The most common thing we see is with durable medical equipment, and durable medical equipment is walkers, braces, wheelchairs, crutches, anything your doctor might order for you to be used at home. It can be diabetic supplies for those that have diabetic supplies where they need to prick their fingers and check their blood sugar. All of those things are durable medical equipment. And what we most commonly are seeing these days is someone calling a senior, a Medicare beneficiary, asking them, typically they start with, do you have any pain in your knee or your back? Well, at our age, we all have pain somewhere. And they'll say yes. And the person then responds with, we can provide a free brace for you. We all know nothing is free in this world. And they follow that up with questioning and getting their information on Medicare, their Medicare number, their date of birth, any information that would allow them, anything that would allow them to then bill Medicare. In some cases, folks will receive the braces. In some cases, they will never receive anything, but either way, Medicare is going to be billed thousands of dollars for something that may or may not work. All durable medical equipment needs to be prescribed by your personal physician for a specific reason. I always tell people my mother weighed 82 pounds. She had 3 different back braces, which were fitted for her specifically.
That's
and
what
never
I was going to
fit.
say. Yeah, I was going to say, wouldn't you, instead of just, you don't buy something over, over the phone or something like that, you, especially, a brace or something to where you would need to be fitted for it.
Correct.
And measured. And that's the important thing.
And how does someone who has never met you or know anything about you know what you really need? That's what your personal physician is there to do. Let me say that Medicare fraud in particular is a $60 to $100 billion per year cost to Medicare.
Wow.
And I always tell people billion with a B. You need to understand this is a huge thing. And durable medical equipment leads that.
I get calls there almost every day from people mentioning Medicare, and we need to do this. And I always just say, I'm not on it yet. I've got insurance. Bam, click, hang up on them.
Our first thing we tell people is if it's not someone you know, don't answer the phone. But the second is if you answer the phone and someone is asking you for your personal information, hang up.
Right.
If it is your physician, you can always hang up and call your physician's office back where you have control over that. But never give your information to anyone you don't know that's not your health care provider.
And they've gotten so sneaky now that when you get a phone call, it's a local number.
Oh, absolutely.
It'll be a 228 number. It's like, who could this be? And you answer it. And then, you know, of course, you have the robocall on the other end talking about, and it's like, again, just hang up.
That's
Just
it.
hang up. What can people do about DME fraud?
The best thing to do, again, is hang up the phone and don't speak to them. We say protect, detect, report. Protect your Medicare information. Never give that out. It's worth more to a thief than your credit card because it has no limit. Detection is look at your Medicare summary notice, which arrives every 3 months. Make sure that's your doctor, your lab, you had those tests run. Or if you have a Medicare Part C, which is generally through one of the private insurance companies, they will send out an explanation of benefits, which will come about once a month or whenever you've been seen. Read those, make sure that's your information. And the last thing is report. We are here for you to report that information too. If you're just not sure if that's a fraudulent charge, you can call us. Our number is 877-272-8720. We are a government program. We're there to serve our Medicare beneficiaries, and it costs them nothing. We are not selling anything. We are strictly a service for them. We can either help them get it resolved, or we can get it reported to the right agencies to get this stopped.
Yeah, matter of fact, the phone number is on the bottom of your screen there. If you notice, again, it's 877-272-8720 for, you know, if you feel like you have been a victim of Medicare fraud, or you have any questions, you've gotten some calls or something like that, that you're not sure about. And you can also help by volunteering to serve the community.
Absolutely. We have community volunteers, and there's no specificity. They don't have to be seniors, but a lot of ours are seniors that want to serve their community. If they reach out to that same phone number, we have a volunteer coordinator whose name is Sunny, and Sunny can help them get signed up. They can best determine where they need to be if they're seniors within their own communities. Some of them live in the housing communities. Catholic Charities here on the coast has a number of them. So there's just a lot of opportunity there.
All right, Danielle, thank you so much.
Thank you.
Danielle Guillory, Community Outreach Specialist from Senior Medicare Patrol. If you'd like some more information or you feel like you've been frauded, call the number on the screen. They'll be more than happy to help you out.